जो ड्रग कंट्रोलर ने वैक्सीन्स अप्रूव किए बहुत ही सेफ़ है, इफ़ेक्टिव है, अच्छे हैं और ये सब लेने चाहिए क्योंकि उनका जो साइंस है सब चेक किया है उन्होंने, बहुत डिटेल में गए हैं और उसमें हमें विश्वास और फेथ रखना चाहिए। तो अभी हम खाली ये केस बोल सकते हैं कि सब जो वैक्सीन्स आने वाले ज़बरदस्ती तो किसी को बोल नहीं सकते लेने, मगर बहुत ही ज़रूरी है कि जितना वैक्सीन्स हम ले सकते हैं हमारे खुद के लिए नहीं है, हमारे सब फैमिली और जो बच्चे हैं माँ बाप है उनको भी प्रोटेक्ट करने के लिए ये लेने के लिए ज़रूरत है।
ग्लोबल पेंडेमिक का सिचुएशन है इंडिया में भी और बाकी वर्ल्ड में भी, बहुत ज़्यादा पैमाने में इसको वैक्सीन्स को डिस्ट्रीब्यूट करना है। किस तरीके से ये रोल आउट का पूरा प्रिपेयर्ड किया गया है और किस तरीके से कितना कैपेसिटी हमारे पास में डिस्ट्रीब्यूट करने की?
नहीं तो अभी तो हम 70-80 मिलियन डोज हर महीने बनाते हैं, उसमें से कितना इंडिया को मिलेगा और फॉरेन कंट्रीज़ को जाएगा उसकी भी प्लानिंग चालू है। बहुत सारे ड्राई रन्स और ये सब प्रैक्टिस भी हमारे देश में हो चुकी है और हेल्थ मिनिस्ट्री ने बहुत अच्छी तरह से लॉजिस्टिक्स का प्लानिंग भी किया है। हमने प्राइवेट प्लेयर्स के साथ भी पार्टनरशिप की है ये सब ट्रक्स और वैन्स और कोल्ड स्टोरेज के लिए, तो बहुत सही सलामत अच्छी तरह से अभी सब चल रहा है। इंग्लिश में तो सब दिया है।
नहीं सर, इंग्लिश में
सबको चलेगा।
ओके क्विक चलो।
Your take on
चलो, I have to go in 5 minutes. Then I give you 2-3 minutes and I have to.
What is your first reaction after a long wait? The first dispatch has happened.
So it was a big relief to everyone here at Serum Institute and all the government officials and departments that we've worked tirelessly for the last few months, doing the clinical trials, development, stockpiling of the production. So it was a great day and we celebrated the trucks going out early this morning. And now the real challenge for 2021 is to get as much product out there to the most vulnerable sections and, hopefully as we've seen, that's going on smoothly and we hope to vaccinate a large population in India in the coming months.
So what would be the price of vaccine? For what price are you providing it to the government and what would be the price in market?
So we've given a special price of 200 rupees for the first 100 million doses only to the government of India on their request, that we want to support the Aam Aadmi, the poor, the vulnerable, the healthcare workers and all of that, and after that we will be selling it at 1,000 rupees in the private markets, and of course to the government of India we'll still maintain a very reasonable price, but it'll be a little bit more than 200 rupees, which is our cost price. So we decided not to make any profits. We wanted to support the nation and the government of India and Modi ji for the first 100 million doses, and after that we'll try to regain the big capital and OPEX expenditure that we've invested to deal with this.
So being world's largest manufacturer, you also hold the responsibility to supply vaccine to other countries as well. And so how are you going to manage that with India's population in terms of?
Well, it's very challenging to keep everyone happy. As you know, a lot of countries have been openly writing to India and the PMO's office also for vaccines to be supplied from Serum Institute to their countries. We're trying to keep everyone happy. We have to take care of our population and our nation as well. And, we're trying to supply vaccines to Africa, South America. So we're doing a little bit everywhere. So we'll try to keep everyone happy. Thank you. Thank you. No, thank you.
All right, you were listening to Adar Poonawalla of the Serum Institute of India giving out some details of the vaccine rollout. He says 80 million doses are being produced every month. Some of it for India, the rest of it for other countries. The Health Ministry, he says, has managed the logistics very well, including a robust cold storage system. Adar Poonawalla mentioning that this is indeed a big relief for everyone in Serum Institute, as everyone has worked tirelessly around the clock for the development of this vaccine, for stockpiling, in order to get as many and as huge a volume of products available. First catering to the vulnerable sections. He says that 200 rupees is what will be the initial pricing to support the Aam Aadmi and the health workers, but going forward the price would be 1,000 rupees in private healthcare and private entities will be selling it for 1,000 rupees. He also says a lot of people have written into the Prime Minister's office asking for vaccines from the Serum Institute, and therefore it is highly possible that the Serum Institute vaccine will be supplied to South America and to Africa. That is all Adar Poonawalla said in his statement to the media just now. As India gears up for the mega vaccination drive starting 16th of January, the first batch of Serum Institute's Covishield vaccine has reached 6 cities, including Delhi and Ahmedabad. Vaccine doses have been dispatched to a total of 13 cities, including Hyderabad, Bengaluru, Ahmedabad, Patna and Chennai. Remember, the government has ordered 1.1 crore doses to begin with for the first phase of the vaccination drive, which starts from Saturday onwards. So as of now, we have confirmation that it has reached 6 cities as of now out of the 13. We're still waiting for confirmation from the other 7. We do not have that report right now, but 6 of the cities have already received their dispatch. That is a big update coming in right here. So we are going to also talk about how will the vaccine finally reach you. There are a number of steps that are going to roll out from the main storehouse. It will go to the state's refrigerated vans, and they will transport the vaccine to the state storage centers. Then the state storehouses or the storage centers will dispatch it to the district vans that will take it to the district stores. So that is how this entire dissemination process will begin. The district stores then, of course, will have to dispatch it to the primary healthcare centers. The vans will transport the doses to these primary healthcare centers, which would, of course, cover the last mile. That is, of course, it will reach the interiors through the primary healthcare centers. The healthcare centers also might have to, in some cases, dispatch it to sub-centers in rural areas so that the doses can reach the last person in the country. And this is how it will be transported via ice boxes to the respective vaccination centers. All these centers have already been identified, or entire network has already been put in place. Now it is the time for the actual rollout, for the actual logistics to start working out the dispatch. Well, let's move on and talk about how in the capital city preparations are underway. The city of Delhi continues to ramp up its ground level preparations for the vaccination drive as it plans to vaccinate 3 lakh health workers to begin with as the top priority list. Now, around 1,000 vaccination sites and over 600 cold chain points have been set up. The Rajiv Gandhi Super Speciality Hospital will be used as one of the vaccine storage hubs in the national capital.
As far as the role of Rajiv Gandhi Super Speciality Hospital is concerned, we have allotted the area, the utility building, to the Directorate of Health and Family Welfare for the preparation of this Delhi State Vaccine Store, and we have officially allotted the ground and first floor. The police has been deployed here, and the hospital has also given some security staff 24/7 to look after the building and the equipment.
Moving on to the state of Tamil Nadu, the state plans to vaccinate 5 lakh frontline workers during the first phase of vaccination. 51 cold storage facilities have been readied at the district level, and over 47,000 vaccination centers have been identified. Mirna spoke to State Health Secretary on the ground level preparations. Let's listen in.
Can you brief us about the first consignment of the COVID vaccine that have reached Tamil Nadu?
See, as promised by Government of India and communicated, they have delivered that exactly as they informed. They sent a video. They had a video conference. Then they had sent a written communication, and of course the translation mail also came in the middle of the night. And we were ready to receive that at 10:20 sharp. It came. The flight also came in time. Now we are quickly moving the 45 these boxes, which are all maintained in cold chain, to our main cold chain center center here in the state vaccine center. From here, we have drawn up plans to redistribute it to 10 regional centers and subsequently to 51 walk-in coolers in the district without affecting the cold chain process. So the biggest issue is maintenance of cold chain process. So that's why particularly in the sunlight and all, we are slightly anxious that it should be quickly moved into without hindrance. Any new vaccination program, we have to be alert. So adverse event monitoring is also very critically being done. So we need to, we are confident and we are regularly getting enough technical inputs both from the public health experts and also the logistics aspect is done. Honorable CM is very particular that everything should go on perfectly and he is also reviewing it. Honorable Health Minister also reviewed it late in the evening yesterday.